Welcome to What We Think, brought to you by Marts&Lundy. Marts&Lundy is a strategic consulting firm committed to advancing the field of philanthropy. We help mission-driven organizations build the capacity they need to achieve their highest potential. In this podcast series, our experienced consultants and special guests will share insights on current opportunities, trends, and challenges in philanthropy.
Welcome to this Marts&Lundy podcast. I'm Jacklyn Lewis, a consultant with Marts&Lundy based in Burlington, Ontario, Canada. In today's podcast, we are diving into an important topic for our sector: building diverse and inclusive philanthropy. 1 year ago, we published a report on our website highlighting how leading organizations are living their commitment to diversity, equity, and inclusion. You'll hear me refer to diversity, equity, and inclusion throughout this podcast as DEI. I feel very honored to be joined today by Ken Mayhew, President and CEO of Osler Health System Foundation. For our listeners, Osler Health System Foundation supports hospitals in Etobicoke and Brampton, which is in the Greater Toronto Area. The foundation recently exceeded its $100 million campaign goal by $9 million. Prior to his work at Osler, Ken spent 20 years with the Multiple Sclerosis Society of Canada. He is well known in North America for his leadership work and as a volunteer. He is currently the chair of AP Canada and participates with Imagine Canada and the Rideau Hall Foundation. Ken received the CEO in Action Award from the Diversity Journal for his work in inclusive board and fundraising development. Welcome, Ken.
Thank you, Jackie. Glad to be here.
I interviewed Ken for the report last year, and I was inspired by how the health system and the foundation have embraced DEI as a priority. Now, 1 year later, I look forward to hearing an update about how Osler continues to move the needle on this important topic. Ken, as we begin our conversation, I think it's important for you to set the stage and share with our listeners what the demographic of your community is and what this means for your fundraising strategy.
Yeah, I'm happy to do so, Jackie. And again, I'm very grateful for the opportunity to provide an update on our journey. We try to share what we've learned, what succeeded, and also the lessons learned along the way, the things that we continue to kind of struggle with, as we all do on this journey. And I'd also add that I'm very aware, as you and I have discussed, of my obvious dimensions of privilege. So I provide these perspectives from that perspective. For some, my ideas on DEI are maybe pushing them a bit further than they're comfortable with, but for others, I obviously don't have lived experience. I don't speak for them, and I would never attempt to. But what we try to do is we try to listen, to understand, and I guess all of us, right, to accept that we're on a lifelong journey. We're all in part of this together. So that's relevant, as you said, because at Osler, we're enormously diverse. So Brampton, which is just outside of Toronto, where I am today, is the fastest growing large municipality in Canada. It has enormous healthcare needs, which I am responsible for helping fund with my community and with my team. And it also is of modest socioeconomic means. So we have 57% of our population who self-identify as visible minorities. They're from 234 different ethnic groups. So we have sort of lots of different voices around the table. And if we took that by way of comparison, maybe 20 minutes, 30 minutes from here, a community would self-identify with about 18% of the population who would describe themselves as visible minorities. So this is sort of, where we are, and it's our work, and it's fantastic work to be able to meet our community where we are. So where they are, actually, not where we are, where they are. So we discussed this a little bit a year ago, as you said, as part of that report, but also given that we were kind of the epicenter of the pandemic from an incidence rate and many of the inequities that actually helped participate that, we thought we were committed to DEI a year ago. We're far more committed now. And I guess specifically in terms of strategy, it's not a one size fits all, as we've talked about before. It's because that just doesn't work in authentic ethnocultural engagement. It's about credibility. It's about trust, things that don't work very well on a linear timeline. not really good as part of a 12-month plan. You can't really measure them bi-weekly. They're sort of longer term things. And we seek to do that through deeds as much or perhaps more so than words. That's the heart of our strategy. That's the heart of our values, and be that with our community, our donors, stakeholders who don't give, our staff, or our physicians. And maybe one specific example, because I know there are a lot of practitioners with us, and I'm grateful for your time to listen to this, is that in our annual business plan, we established a South Asian Advisory Council. So this would be the voices of leaders in our South Asian community who understand the needs and the motivations of our community, and they can provide that guidance that can help us to, understand the different cultural contexts, the different historical backgrounds relative to the tradition or the lack of tradition of giving. In particular, very important for us to understand seva, which is a Sikh notion, which is very important relative to giving in that context. We also literally, when I said we meet donors where they are, we literally physically do that, be it a gurdwara, a temple, a mosque. That's also one of the things that we've done that we found has been very helpful in terms of establishing the credibility required to do this kind of work.
Thanks, Ken. I love what you're saying about this being a lifelong journey. We all come at it from a different place, and I know that I definitely have a lot of learning to do. Having these open and public conversations takes a lot of courage, and I really appreciate you doing so today. It was beautiful to hear about the heart of your strategy. Is there anything else you'd like to say about your day-to-day operations and how you live out your commitment to DEI on the ground level? Specifically, I'd love to know more about how you prioritize DEI in your hiring strategies.
Yeah, thank you very much. I very much appreciate your kind words, and I'll pass them along to the team. I would say again for us, and as you just reflected, it's a journey, but it kind of has to be at the heart and the center of the journey, right? It helps literally define the path for us. It's not that thing that happens over there or that person who has this on the side of their desk. And it's about deeds, not words. So, I think we've talked before is that leaders can say whatever they want about their commitment to this and how much it concerns them. But I think if you're profoundly thoughtful about this, it's both professional and it's personal. It's about becoming a better human, let alone a better fundraiser. So that's central to what we do in the context of how we operate. Certainly how we hire is one dimension of that. Maybe take it up a little bit. I think to some extent, it's also about our evolution as a sector. And I have the great privilege, as you noted, of being the chair of the AFP Canada. It's a great responsibility and opportunity. I'm very humbled by that opportunity. And within that role, I would say that I've received some fair criticism, which is criticism of our sector, is sometimes looking at all of this through a traditional Judeo-Christian perspective, which is sort of like, would you like to make your pledge over 5 or 10 years? We've lots of different options open for people, or that maybe awareness building is the antithesis of fundraising. And it's simply not that. It's not that basic. It's much more nuanced. It's a bit more profound. So in the work that we seek to do in the communities that we serve, it takes a different approach. It takes a longer term, broad thinking approach. I've thought many times, and I've been in some difficult conversations around budgeting because, it's not transactional. It's not transactional. And the investment strategy goes far beyond the ROI that you might see quarterly on a balance sheet. It's kind of a longer play. Sometimes I think about the work we've done in our sector to educate internally around planned giving, right? And sort of some of the half-life of that. And it's kind of similar to that. So specifically, we hire staff as much as we can from our community who speak dialects that are prominent in our community. That sometimes means that we don't necessarily have team members with deep experience, but we look for commitment in other ways, community involvement, thoughtfulness, sometimes a personal affinity to our healthcare systems, which many have been born in our communities. So it's sort of thinking that way than perhaps, some of the traditional academic credentials, although those are also great. We offset that, supplement it, and I think frankly, make it far better by recruiting diverse community volunteers who come from all walks of life. We have a spectacular member of our board who, is a DJ. That's sort of what he does in his day job, but he has deep personal commitment to the cause and deep credibility within the cultural groups that he's involved in. So the dimensions are multiple, and the ability to impact is as a collective rather than as individuals. Everybody brought onto the board or the organization understands that. It's not about me, it's about us, and it's about what we can accomplish together. And we also seek, lastly, and I'm sorry, but this is a bit technical, to view our goals, because you have to have goals, right? We build hospitals in the fastest growing large municipality in Canada. There's no lack of need. But we set those goals through a cultural lens, and that sometimes will literally mean a longer timeline. It may mean, sort of an average gift per year that's a bit smaller and it takes a bit longer. Or sometimes it doesn't start even as a pledge per se, it starts as engagement. And from that, perhaps we'll go to 2-3 years worth of community events and establish the credibility within that community such that they're willing to make an investment of a, transformational nature, and it's transformational to them. Some unfortunately do that at an 8-figure level, others it might be a 5-figure level, but it's sort of the sort of notion of meeting people where they are and realizing that sometimes the goal is more than financial. It may be about engagement or credibility or trust, such that, in those conversations that we're not a part of, things are happening to sort of indicate our credibility and that we're an entity worth working with in terms of we do what we say we're going to do, and we do it in a very credible and authentic and transparent way. So those are sort of some of the specifics that we do to try to embed. And as you said off the top, we fail, we fall down. Sometimes we say the wrong thing, we get too enthusiastic, or our approach is not necessarily culturally sensitive. We mispronounce a name, in which case we apologize and we move forward. And that, I think, is a critical thing that time and again I've seen people really appreciate. They're grateful for the thoughtfulness of it, and not, that sort of this, either it's not thought of at all, or also it's kind of not too formulaic. It's really quite personal, and it's done one-on-one. And we've been really fortunate. We've seen some really strong, not only financial results, which we're fortunate to have, but I think much more our reputation in the community is really humbling. And I think that is one of the benefits, maybe perhaps one of the non-financial benefits of this approach.
I appreciate you sharing your experience, especially that you bring people who are passionate about your hospital and the community to the table as volunteers and as staff. Goal setting is a challenging exercise to begin with, and you're embedding a whole new level of flexibility. So it's great to see and hear that you're already getting results in the community, especially through the strengthening of reputation that you had mentioned. You've had a lot of success in this area. You've been working in this area for a while now, and the award that I mentioned earlier, the CEO in Action Award, was in 2015. I think that speaks to the commitment that you've been bringing to this for a long time. Can you share some other successes that you've seen from your commitment to DEI?
Yeah, I'd be honored to. I think to some extent the match is very closely connected to my own personal value system. I have cultural diversity within my own immediate family. I've sort of, despite appearances, have never known it kind of any other way, and I'm really grateful to help somebody along their philanthropic journey, regardless of where it ends up or regardless of kind of where it comes from. So when you work with an organization who shares that value and helps lift up that value, especially through our volunteers who have the credibility in the community, we're practitioners, we don't necessarily have that, but the entity does, then you start to get in conversations that are larger. And I think perhaps most recently, we would be in a situation where we're in conversations with a family, with a local company, where the founder, and it's a couple, which I think is also beautiful because it's not sort of a one person making this decision, it's a couple decision and then a family decision, that after they came to Canada from India, they were able to establish a family, grow a business, benefit from what was given to them in the community. And when it was time to give back, they thought, first of all, about a gift in the 6-figure range. And then they thought a bit more about potentially a gift at $1 million level. And then when, not myself, but those from the community spoke to them about how much that would mean, how much that would sort of inspire others to do in kind at their own level, but kind of in kind, they ultimately made a $10 million completely unrestricted gift to us. So it's to the greatest needs of the entity as determined by those in the entity who know what need to be done. And I mean, think about that in these times, right? Just the indication of trust that kind of conveys. And that was really, really humbling. And it's the BVD Group, which is, again, a company you've never heard of, but there are thousands of those companies, you know, in our communities all across North America. And it's their timing. It's not our timing, but we sort of set an ecosystem and a context such that they're welcomed. And we thanked them when they gave us a $100,000 gift to help our frontline heroes who were fighting COVID. We literally gave the staff massage therapy and snacks in respite rooms and brought in on-site counselors. Unfortunately, that's what the staff needed. So they made a donation to that, which was very generous. And now, less than 2 years later, they've come back with something that will, in our community, that's the equivalent of a 9-figure gift in other communities. That's enormously impactful. And in the 4.5 months since they announced that gift, we have 4 other gifts so far that are at the 6-figure level and 2 being considered at the 7-figure level. So it's really an incredible thing to be a small part of.
I was just recently reading the Imagine Canada Newcomer to Canada Multiculturalism report that they published in 2020, and hospitals were identified as the #1 priority for people who are new to Canada. And I have a great, deep appreciation for that. And healthcare is something that we're all going to need at a point in our life, whether it's, an exciting moment like the welcoming of a new child or a more challenging time towards the end of life or anywhere in between. And, your community hospital is just such a tremendously valuable resource. And to have community rally around it and support it, it benefits everyone. I think that's just such a beautiful gift.
I do as well. And I think one of the unfortunate gifts, and we didn't want this gift, but one of the unfortunate gifts that we received from the pandemic is exactly what you said, Jackie, that in the story of your life, 80% of your healthcare is going to happen at your community, right? It's going to happen right here. You're not necessarily going to get to see the kind of the global leaders, and we're grateful that they're there. One of those entities, saved my little brother's life, so I'm grateful that they're there. But in the story of your life, it happens close to home. And I think COVID really underscored that for many. And that's exactly it. And, not only us, so many other issues, social justice causes, food insecurity, there's lots of things. There were sort of pre-existing pandemics that the pandemic brought to life. But for community healthcare, you're absolutely right. They were on the front lines of all of this. And I think it's fantastic that that's recognized philanthropically.
We are tremendously fortunate to be surrounded by dedicated staff on the front lines. You're very right. I appreciate that. I'm going to prompt you. There was another story I think you may want to share about a gentleman in a John Deere hat that I haven't heard the end of, that I wonder if you want to share.
Yeah, I'm happy to. And, I just, as an aside, the work that we do is challenging, right? In the course of the work that we do, we spend most of our time hearing no. Or kind of other criticisms where in the morning we're too sophisticated, in the afternoon we're not sophisticated enough, for overhead or wherever the other issues are. So this was an instance completely unexpected, pre-opening donor tours of a new hospital where one hadn't been built in 50 years. By the way, that was in June 2019. So like literally 6 months later, it was on the front lines for COVID for that community. But at the time, nothing had been done. We had a gentleman at the back of a tour, very quiet to himself, doing his own thing. And we were taking clinical leads, we're taking them through the different units and women and children's units and the different things that were made possible thanks to the generosity of 9,200 and some odd donors in Etobicoke. And at one point his phone rang, he left, he asked to be taken back down to the lobby, and he was obviously, in distress. And about 10 minutes later, I was in the lobby talking to some volunteers from one of our cultural groups, Aloko Mander, and just thanking them for coming out and letting them know what it is that we do. And he walked in, he asked to speak to me, and an envelope in his hand, and he handed me that envelope, and then he told the volunteer, not me, unfortunately I have to go. And in the envelope was a check that he made out to us as a grateful patient to thank us for the care provided in the hospital. And the timing of the check was that he had just left because his wife had died in our hospital, and he had gone because she had been passed away. And then he came back to drop off a donation to me, which I know the amount doesn't matter, but I know to him that's the largest gift he'll ever make to any charity ever. And in the work that we do, frankly, it wouldn't be considered a large gift, but it is a large gift. And that not only brought everybody in the whole place to tears, but it inspired the volunteers. And that was on a Saturday. And I heard that on the Sunday at that mandir, the Swami stood up in front of 3,500 people and told the story of the man with the John Deere hat. And I just thought that was one of those great examples, you know, of the impact of the work that we do. He just saw a poster that said, please help us equip our hospital. We didn't even speak to him. And I think that that's just, yeah, it's one of those stories that helps me on those days that are a little longer, which I think happen from time to time.
Thank you for sharing that. I'm not sure if you can see on my face right now, and I know that no one else can see, but you did just bring me to tears. That is beautiful. What a remarkable example of philanthropy and the power of grateful patient giving.
Right.
Thanks, Ken.
You're welcome. Yeah, no, I thank him. And of course, from a processing perspective, we know his name, and I sent him a very brief card and have had no contact with him since, but I think about him, and he gave us all a gift that day.
Wow. These are really meaningful, impactful examples that you've just shared with us. They really highlight the importance of that long-term commitment that you started us by thinking about. My final question for you today is, how do you hope to build on this success? What comes next for Osler?
You know, I think we, as all of us in our profession, and by the way, I can't think of any better profession to be in, more meaningful profession to be in, regardless of what element of fundraising you're involved in, we'll kind of keep growing. We'll keep learning. We'll keep listening. We'll keep evolving. I suspect we'll keep failing. But we're going to do so in an intentional way. So with and through our volunteers and our whole Osler health system, who are equally committed to this, we're going to keep going and keep growing. As an example, our entire leadership team took a leadership course from the Canadian Centre of Diversity and Inclusion. So we wanted to deepen our understanding of issues. There was quite a few very confronting things within that course. I would recommend it in a heartbeat. And also to allow us to become more aware of the biases, right, that we all have, because we all have them. And as a leader, this change has to happen with me. It has to start with me. So I want to have a greater awareness of that. But that then cascades specifically down to the team, and not in nice words necessarily, although inclusively, collaboration and integrity are three of our values. But as a member of this team, you are evaluated in your annual performance review against the extent to which you live those values, and with colleagues internally, but also with the community externally. So I think these are two ways where we may be embedding this work thus far. And as I said, we will likely slide back from time to time. And that's because I think as a foundation, you know, we found ourselves in an epicenter a year or two ago. And I kind of think we find ourselves, as I hope I've been able to convey today, in another epicenter. But this one is around DEI and fundraising, with the challenge of that and with the promise of that. And I really can't think of a more important change to be a part of. So we're going to continue to do our best. And if we can ever help anybody by sharing our journey with them, we'd be more than happy to do it.
We really appreciate you sharing your journey with us today. This is remarkable. The conversation needs to continue, and it needs to be at the forefront. I think you're right that the epicenter and the opportunity that it presents is here, and we should take advantage of the momentum that has been created. I made a few key takeaway notes from our conversation just now that I want to re-emphasize. The first being that this is a lifelong journey. I think that's come up a few times throughout this. It's really resonated with me. And the second is that to be successful in this work, we need to be intentional and embed DEI at the heart of our work. The third is that this is about deeds and not words, putting the money where the mouth is. And finally, we're going to make mistakes and we should move forward. Those are my 4 really key takeaways that I'm going to really resonate on for the next little while.
Maybe, just as a fifth, by way of self-compassion, few have this figured out. And if you have, someone beside you probably hasn't. So please reach out and give them a hand. That's one of the greatest things about our sector, is that we support each other in the work that we do and tend to make each other better. So again, I'm really grateful for the opportunity, and thanks as well to Marts&Lundy for lifting this whole topic up. It's important.
And I truly appreciate you coming today and having this conversation with us. You can find the full report on our website. It is titled Towards Diverse and Inclusive Philanthropy, and it includes interviews from leaders across sectors in the United States and Canada, including Ken. You can learn more about Osler Foundation's great work there. I hope you enjoyed today's episode.
We thank you for listening and invite you to visit our What We Think page at martsandlundy.com. Here you will find blogs, webinars, and special reports with more of our insights.